So I wanted to create this presentation on how to present to an ED attending. This could also come into play as a student if you have a PA that's your preceptor or a physician, or if you're a clinician and you're actually just working in the ER. And this sounds like a boring topic, but in reality, it's very important because it's the point of communication between you and your supervisor in terms of them being able to see your reasoning, then being able to see your clinical judgment, and then them being able to develop a certain amount of trust in you. Because as they work through the process, if you understand what you're doing and they can find that you're reliable, then that trust builds up between you and your clinician. So it's actually really important to make sure that you do it right. And there's actually a lot of videos online, but I wanted to create this specific video tuned to what we were going to be talking about during our lecture. So a couple of points to remember. Number one is to stay organized. You really need to have a concise presentation and be able to stay organized and organize the elements in that presentation. I like to use a notebook where I just take a piece of paper from the printer and just write down pertinent negatives, pertinent positives, test results, labs, and then be able to concisely give that to the ED physician when I'm presenting to him. And you want to be concise. And 5 minutes in an emergency room is that's like a week. That's a long time. And so you want to be concise and you want to get to the point really quickly, and we'll talk about how to do that. Additionally, make sure that you show that you entertained a differential diagnosis, because that's very important as well. Because you want to make sure that in an ED setting that you've ruled out anything that's dangerous or life-threatening to the patient. And your preceptor or your supervisor is going to want to know that you entertained those ideas. So if you really want to look at like a rock star in the emergency room, number one, you're going to want to take ownership of the patient and be able to really make that patient your own and be able to understand that. Additionally, you're going to want to make a plan. And that shows that you've worked through the problem, you've done your HPI, you've done your physical exam, you may have ordered some tests, and then you go back through. And if you've actually gone to the point where you've developed a plan, you've decided what antibiotic to give or what treatment to give, then you're definitely going to look like a rock star in the ER. So we're going to talk more about that during this screencast. I wanted to show you a fun way of showing what not to do. So I hope you enjoy the next part of the video.
Okay, Dr. DeFaria, I have this patient that I want to admit to the hospital, and I think he's like 80. Oh wait, no, sorry, she's a girl. She fell and injured her hip, and X-ray shows a left trochanteric fracture. She got some pain meds, and Dr. Plum wants to have her admitted for surgery. He requested hospital list due to her age and comorbidities.
What is the past medical history?
Okay, so she has this hypertension, and she's like super old.
What do her labs show?
I think her labs look good.
You have not addressed the rhabdomyolysis. Let's ask the chief resident how you did.
So I hope you like that video. It's kind of fun, and of course it's kind of silly. But in reality, it's eerily similar to what can happen if a presentation to the provider or your preceptor goes bad. And again, that's the point of communication and trust building between you and your supervising doc. And of course, you want to make sure you remember the past medical history, remember your lab and X-ray findings, and then be able to present the patient in a clear way. So I'm going to give you some tips on how to present to your preceptor or supervising physician. And again, these aren't in particular order, and there's a lot of methods, but the main point is just stay organized. So what I like to do is I like to start with a quick description of the age and gender. So patient is a 35-year-old female that comes in with right lower quadrant pain times 6 hours or a few days or otherwise. And then what's a little bit counterintuitive, but what I like to do is start with the disposition, meaning are you going to discharge, admit, or transfer the patient? So that way the patient is framed in the doctor's mind, and he can kind of listen to what you're saying after that with that frame of reference. And I think it helps to organize it as well. So patient potentially could be discharged today, or I'm planning to admit the patient for appendectomy based on consultation. And then you go into your old cards, your HPI. Make sure that you state pertinent positive first, pertinent negatives last through the HPI. Mention the vitals. Those are important, obviously, in all situations. Mention whether the patient is ill appearing or not. And then pertinent exam findings grouped in order of system and pertinent positives and negatives. And then again, any lab results or results of imaging that you've done. I ordered a CBC, it showed this. I did a CT scan, it showed that. And then any treatments rendered. Did you give him Zofran? What did you give him for pain medicine? Did you give him any antibiotics? Have you intervened in what's going on? How much fluid have you given them through that process? And then consultations with a surgeon or a cardiologist. And then make sure you mention who by name and what specialty that person is in. And then give them a quick synopsis of what that specialist told you. So in this case, you could say, I talked to Dr. Jones, who's over in general surgery. He's planning on taking the patient back for an appendectomy tonight. Based on his recommendation, I started her on IV Zosyn as a pre-op med, and then he's going to come in and see her later. And then, and then of course, any prescriptions you give if the person is being discharged, and if the person is being discharged, what is the follow-up plan? What is the direction that you've given the patient to go? And do they have a direction? Do they have a primary care that they can follow up with? That's going to be real important as well. Make sure you've answered any questions that you can anticipate from the provider. And then, of course, things to remember. I always go by the saying, no information is better than bad information. So if you don't know something, say that you don't know. You know, it's rough to say that, and they're going to be like, well, why didn't you address that? But in reality, it's safer. And it can cause a lot of confusion if you tell the supervising physician something that isn't accurate. So you want to make sure that you're accurate, and if you just don't know, then tell them you don't know. So in summary, make sure that you take ownership of the patient. That's your patient. Make sure that you order labs and imaging potentially. Of course, as a PA student, you're not going to be able to do that. But the way that you present can definitely show that you know what you're doing. The preceptor will gain confidence in what you're doing, and you'll look like a rock star in the ER. So main points are to make a plan and really take ownership of that patient. And I hope this helped. If you have any questions, we'll be going over that lecture, and we'll be discussing this further and give you a chance to role play how to do this during lecture. Thanks.
Dr. Nefario, I have this patient.
You ruined it! You're such a villain!
I'm having a time! She's like,
What do I say?
you just go,
You don't really say anything, you just have action.